So without further ado, we're going to get started this afternoon. It's my distinct pleasure to call Dr. Hugh Davies and thank him again publicly for joining us with the BC Construction Safety Association yesterday with our Respiratory Hazards Working Group, and to speak to us this afternoon on improving Canadian exposure data. Thanks, Hugh.
Thanks, Kimberly. So yes, now we're going to talk about exposure data, and particularly the Canadian Workplace Exposure Database. And for some people, this may seem a little like deja vu, because every so often this comes around and we talk about it and then it kind of disappears again. So that's one of the issues I'm going to be talking about today, is how to make this a more sustainable and usable resource. I was on YouTube recently and I saw one of those videos that sort of, if you like this, you'll like this. And it was how to give a great introduction to a talk. And there were three things, and I've already forgotten two of them. But one it said was, show your audience a fascinating fact. And so as I was going to talk about data, I looked up, well, what's fascinating facts about data? This is from the World Economic Forum, the people that put on Davos. And this is their estimates of the data used and created and transmitted in a single day in our society now. And so there's some pretty big numbers on there, and there's even some units that I had never even seen before. So down in the bottom corner here, there's the actual amount of data that exists in the universe today, and it's in zettabytes. So there's the fascinating fact of the day. Once you get beyond terabytes and petabytes and exabytes, and you get into the zettabyte range, and then eventually we'll get into the yottabyte range, which is as far as we can apparently go. So why have I put this up? Because in contrast to the billions of bits of data that fly around the world every day, when you look at the amount of exposure data that we actually have in the world, it's relatively small. And this graph is a sad testament to what's happened to exposure data and exposure data collection in Canada over the last 30 or 40 years. This is taken from the database, the Canadian Workplace Exposure Database, which I'm going to describe in more detail in a minute. But it just shows the year of sample. So it's a frequency distribution showing the year of sampling on the x-axis and the percent of the data represented in that year. So you can see that there was a short period in the 1990s when we were very good at collecting exposure data, and then deregulation happened, and governments at least stopped collecting this data, and this data became far less available to all of us, researchers, practitioners, clinicians, and so on. Data, make no mistake, there is still data being collected, but it's out there in all sorts of small silos. It's not accessible through any kind of central repository or agency. So this is a quote from a management guru that many of you will remember, James Harrington. But I mean, it could have been written by an occupational hygienist as far as I'm concerned. If you can't measure something, you can't understand it. If you can't understand something, you can't control it. And if you can't control something, you can't improve it. Now, we heard a presentation this morning by Kevin explaining the problems where there is lack of data, that banding is certainly, or qualitative methods, semi-qualitative methods, are an acceptable replacement, but there's so much more that we can use quantitative data for than which is not accessible to us through banding. And I'll talk about some of those uses as we move forward. But I think as hygienists, we all know we want to get out there and measure, and the question is, what's happening to all that data, and how can we make better use of it? So the Canadian Workplace Exposure Database, CWED, is an actual thing. It exists, and It has been in existence probably for about 15 years now. One of the first things that was done out of UBC was a data survey where we surveyed all of the governments across the 14 provinces, territories, and the feds to ask them about what data they held, what were their data management practices. And the information we got back was worrying. This was around the early 2000s that this work was actually done. Some agencies not only had deregulated, but they had already got rid of all their exposure data. So some provinces had actually just, the data had run out of its 7-year retention cycle or whatever, it was gone. Where there was data, it wasn't necessarily coded, it wasn't even digitized, it was still in existence in people's PDFs. And a good example of that was one province where we did a data extraction project. We basically were going office to office and people were giving us PDFs off the top of their cabinets and we had someone reading PDFs and typing in data. So the data was about as siloed as you could possibly imagine into sort of individual reports. Nevertheless, over the period of 2004 to about 2017, we have been collecting data from those agencies. This schematic shows in relative terms where the data has been coming from. So the very first data sets that we obtained were BC from the WCB as it was then. They were closing down their lab and they basically said, here's a CD with all our lab information management system data on it. Pretty similar thing happened with the WSIB. Other agencies like Saskatchewan, Manitoba, the Yukon, we went boots on the ground and actually went into offices, as we said, and got data off of written records or electronic records where they existed. We had several years to and fro with Labour Canada, and we eventually got electronic records from Labour Canada to add to the data set. But every single one of these represents an individual project of data extraction which generated a different data access agreement with different criteria, different dates, and different usage permissions and so on. So it's quite fragmented. Where there's question marks, it means that we have been trying to, or still in the process of trying to obtain data. So CWED, as it stands at the moment, has almost 500,000 occupational exposure measurements in it. And these are all quantitative, with an exposure measurement in ppm or milligrams per cubic meter. There's also information on the substance, which has been measured, the methods, sampling duration, location. It's not a huge list of variables, but they are what they are. That's what people basically record. Sometimes agencies have recorded more, and where it's additional information's available, we've certainly collected it. As you can see, this is similar information from the previous graph. The bulk of the data is from Ontario, and then BC mines, and then the other provinces and so on. To give you an idea of what's in the database, in terms of what substances are represented, there are over 350 different substances that have at least one observation of data. This is a frequency diagram showing all of the substances with more than 4,000 measurements. So you can see the most reported substance is dust, with almost 30,000 measurements, then carbon monoxide, carbon dioxide, and so on. Solvents very heavily monitored, asbestos, welding fume, lead. No big surprises there. I just want to give you a sense of the kind of data holdings. Now, how's it been used to date? As I said, the initial purpose, the very initial purpose was actually to support the CAREX project, to provide quantitative exposure information for the CAREX project, which is carcinogen exposure surveillance, work where CWED was used to help in the determination of the level of exposure in different occupations and industries. And at the same time we did that survey, and we realized that just acquiring the data and archiving it in itself was going to be a project and an important project. So those kind of started at the same time. The data set's also been used in the Burden of Occupational Cancer project, which has been ongoing for the last few years. I'm sure many of you have heard Paul or his colleagues speak about that. It's just been published by France Lebrèche, an overview of the study. And it's been used in a couple of very specific research projects, one by Chun-Yit Han at Ryerson, and another by Jérôme Lavoie's group at Université de Montréal. But the limitation, as I said, in the data access agreements that we have been quite constrained, so we cannot in its current state allow it to be more broadly used, but it can be used for data projects which are related to CAREX. That's kind of fairly major restriction, but it is accessible now as an exposure database. But this is why you don't hear a whole lot about it, because of these restrictions enforced by the data access agreements. Okay, so last year we submitted a grant, and we being myself and Cheryl Peters from Calgary and Jerome from Montreal, and with the support of OHCOW, who are our industry partners on this project, we submitted a grant request to WorkSafe to say, you know, we've got this resource, we need to, as we said, mobilize this data. We need to get it out there for people to use, for people to act on, instead of giving reports like I do about how much data we have. We want to get this data used. And so, funnily enough, we got this response back from them saying, well, this isn't actually a research project. And I thought the next line was going to be, so we can't fund you. But they said, but it's a fantastic idea, so we'll give you the money anyway. And both the reviews were actually quite funny. They said the same thing. This isn't a research project. But they saw the value in this. And so the objectives we set were basically to secure the existing data set. The last thing we want to have done is that 7 years from now, UBC is going to kick it off of our server because they say, well, it's no longer being used, and so on. We also want to make this data more widely available to researchers and practitioners and anyone who could make use of this knowledge. We want to improve our data management. I've been talking to a few people here about exposure data. Exposure data can be very messy to work with for many reasons, and so there's a lot we can do internally with the data to improve it. And then these last 3 points are kind of why I'm here today, is we want to improve everyone's understanding of what's in the data set and have them think about how they could potentially use this data and what kinds of interfaces they would need in order to be able to use it the way they would like to use it. And last, if anyone has any money, of course, then we'd love to talk to you about sustainable funding models. So how does that turn into actions for the project? Well, we have, we're currently working on those data access agreements with all the different ministries. We're going to harmonize them so that they all look alike. And we're going to ask for broader terms of use, but broader terms of reference in terms of use. And we think now is a good time to move on this because of the big open data policy that most governments have implemented. So now is a good time to ask, I think. We're going to set up new committees, management committees, steering committees, but also data management committees, which would be responsible for planning, data management in terms of its data acquisition, data storage, and data use. We don't have enough money from this grant to see all of this work through to the end, but we want to at least have a plan on where the data is going to be stored. If more people are going to access it than just UBC researchers, it has to be in an accessible location. So somewhere like Pop Data BC, if any of you are are aware of that facility that we have there, but potentially it could be something like the CANOE project, which is a nationwide environmental exposure data repository. Thinking about security options, of course, we're already doing that to assure our data owners that the data will be secure and anonymity and confidentiality is achieved. But any new users, any new data providers will also seek assurances around security. And then coming up with access policy and procedures. So if any of you want access to this data for a study you're doing, or to support a claim, or however this data is going to be used, we need to have policies and procedures in place for that access to occur. And the third action item is website, and I'm going to tell you what that website is in a minute, and then webinars and workshops, and I guess I'm doing both at once right here. So where are we headed with this? So you've seen a picture of what's in the existing database. It's very much it's not quite completely stagnant. There's a little bit of new data coming in, but it's coming in very slowly, and I think we can do better. So we're still looking to very much set up a process where data can be input into CWED, and then we're looking, as I say, to create portals for data access. And beyond simply research, which is largely what it's been used for so far, we can identify or imagine lots of different uses that you might find for this exposure data. So at the policymaker level, at government level, priority setting, targeting at-risk populations, starting to think about multiple exposures, for instance, and where they occur and what exposures are occurring in those workplaces. Time trend surveillance, what's happening to exposure levels over time? What's happening to those exposure levels when we have interventions, so evaluation studies? What are key turning points in exposure level changes? One of the things that excites us about the Silica control tool, which is in itself a data repository which is turning over quite fast, is this idea of feasibility testing. So you've got a whole construction industry using a database which is recommending what their risk assessment is, or giving a quantitative risk assessment. As new controls come into play, the evaluation is essentially done immediately, because new exposure data is collected, goes into the database, and the entire construction industry immediately sees that whatever device this is reduces exposure. And we have an example of that right now called a hollow point drill, which, as it sounds like, is a drill which is hollow, and it sucks dust right from the tip of the drill. And it was not designed as a health and safety improvement. It was designed to drill cleaner holes so that glue sticks better, and they waste less time having to re-drill holes. But it actually does a fantastic job of reducing exposures. So once we have that data in the tool, effectively it becomes clear to the entire construction industry and the regulator that this is a new control which lowers risk and should become the new standard. They're expensive, but if more people use them, the price will come down, etc. Anyway, that can certainly be scaled up to this scale. Exposure assessment for epidemiology, for other purposes, and even for claims adjudication work. Who was exposed to what, where? So, in a little bit more detail, where does this data come from? Well, currently, we've been, as this term, harvesting, sort of collecting ripe data from regulators, right? But we've also had been in discussion with some unions. We've got researchers that generate fairly large data holdings, and industry. And again, through the Silica control tool, we've had a different kind of relationship with industry around data. It used to be that industry would complain and say, well, you show me this study, but all your data is years out of date, and everything's changed, and we would say, well, give us your data if you're so confident things have changed. Well, now that cycle is shortened right up. So industry is actually interested in supplying data when they see it's got value and it's actually helping immediately. So this is a chronic disease problem, right? This isn't an injury or an acute disease problem. It's a chronic disease problem. But the exposure data is, and the immediacy of the silica database anyway is changing this relationship that industry has with its data. So we're hoping to get more data from industry directly. We have specific projects. I mentioned the silica control tool. There are ones that we don't have in this country that other countries have, like NEPSI, which is the silica surveillance program in Europe, which is something which could be adopted here. There's no reason that this kind of approach couldn't be adopted. It's collected almost 30,000 measurements over the last decade or so. And some new sources that we haven't really sort of thought about too much, or we don't want to make this tool simply a permanent version of what it is now. The world of data is changing, as we saw in that first slide. Just at the last Apple announcement, which I happened to watch because I've always been a huge Apple fan, and out of the blue, they announced a hearing study. This is Apple announcing a hearing study. They're sending money to the University of Michigan, to Rick Neitzel, who's sort of one of the leaders in noise-induced hearing loss research. And guess what? The new iWatch, well, actually, like the last couple of versions of the iWatch, will have an app on them which records noise exposure levels. And it's an alarm that you can set to alert yourself when you're exposed over 85 decibels or whatever you want to set it to. But more than that, you can also sign up to a health study, and that allows Apple to collect data directly from your watch. So there's going to be the web of things, like we are going to be able to access some of this data. And we need to build a resource which is able to connect to that and use it as well. And also thinking about data aggregators like consultants. And this is something else which has come up out of the Silica Control Tool projects. When we talk about 40,000 construction workers in construction companies in BC, that's not 40,000 companies measuring silica. That's about 5 consulting companies. And so it was relatively easy to go out to the top ones and say, would you collaborate with us when you collect silica measurements, basically make them available to us. And so we have 2 different consultants working in BC right now with which we have this kind of relationship. Okay, so actually that was where I was going to stop talking anyway, because the last bit of this, I wanted to have an opportunity for questions. But also I had these questions for you. If in any way this talk has stimulated in you any ideas, about data sources, that is, if you have data you'd like to share, then that's great. But also, can you think of things that you would yourself use this data for, or ideas that you say, this is how somebody else should be using this data? And how would you like to access this data? We've got a few minutes for this discussion now, so feel free. But there's also the website down here is listed, and there's a tab on there called CWED 2.0, which you can go to, and there's a few comments about this talk. But there's also a box you can fill in with your ideas, and if you just want to stay informed about how this is progressing. You can sort of get on a newsletter and so on. So I'll stop talking there and just open it wide open. I'm sorry, just one microphone, or I can repeat stuff if.
Hi, thank you very much for your talk. It's really interesting. Just a question. Usually when you look at data, you want to reach out to someone to ask some specific questions about any assumptions or how they collected it. So will the database have that kind of information as to the key contact for stuff?
To be honest, it probably won't. Often that kind of data isn't available to us, but we use often the key things are supplied. So what method was used, the sampling duration. There's enough there to do at least a rudimentary quality assurance check. But you're right. Often you want to go back and you'd like to know whether it's indoor, outdoor. If it's there, we collect it, but often it's not. When we're getting new data from for instance, for the Silica project, we have a form, a prescribed form that the consultants fill out for us. But yeah, Kevin.
Dr. Davies, I'm just thinking about some work that I did in Queensland, looking at dimension stone miners and quarry workers. And so I actually worked for the government, and I was able to do research at the same time as being an inspector. And so I measured exposure to respirable crystalline silica, but I also had with me a portable spirometer. And so I was able to measure exposure and also measure lung function at the same time. And the quarries and the mines were quite open to me doing that. You know, we had an ethics application in and the rest of it. But the data was invaluable. We were able to sort of look at a dose-response curve and compare loss of lung function to exposure. And I'm just thinking, is there an opportunity to sort of align something like that here? But just open comment, food for thought.
Short answer is it sounds fascinating. I know there are some jurisdictions that do similar things, like in Quebec particularly, but this is about exposure data, and I think we have to sort of keep our eyes on the prize because it's fairly thinly resourced to start with. So, but the exposure data part of that, we would be really interested in.
If consultants are doing hygiene testing,
Yeah.
obviously getting paid by employers to do the testing, how do you reconcile the data? It has to be redacted or it has to be edited, and do those that are paying for it,
Right.
are they okay with that?
Yeah, so that's evolving. I think we're not quite there yet. With the silica example I gave, the intermediary is actually paying for it, so the safety association is actually paying for the monitoring. So it's easier, you're right, to get an industry to say, we'll share this because they haven't paid for it. But on the other hand, with that specific example, we've really tried to show the benefits of data sharing so that you don't have to have every single employer measuring every single time they go to a work site. And I think that has actually been understood. So the same kind of argument would have to be made for the benefits of this kind of resource, that if you, there's a mutual benefit when you share data. One of the other things I was going to mention and forgot was in terms of consultants, there are also people like Medgate, who now Cority, that would also be a potential supplier of data, but a user of data, right? I could see a situation where their clients who have exposure, who are taking exposure measurements, would be interested to see where their exposure measurements not only relate to compliance, but also to industry standards, just like we're doing with the silica tool. But it could be for solvents or metals or anything. So maybe there's a relationship that could be developed there between the industry and CWED in terms of a data sharing, mutually beneficial. That's what I'm trying to do, is sort of really start to think about modernizing this out of our old collect a sample, show it to the inspector, file it, because that's kind of way we've lived since the 1960s.
Okay, and 3 questions from the web. First one is, has there been thought of, how do you intend on canvassing private industry? Between employers and consultants, there's likely a wealth of data.
So that's it. We've started that process, and it's definitely one of our targets.
Okay, next would be also, how do you plan on reviewing the quality of exposure data?
We certainly have, that will be one of the new protocols we're developing. We've created them already for the work we've done with silica. So we've got often limited data to work with, but we look for standardized methods. We look for clear information on industry. We look for clear information on duration of exposure. And then we set criteria against which those are measured.
Okay, and lastly, has there been thought of creating a data collection tool to help streamline your data entry and to ensure the fields you need are captured?
Again, that will come out of the work we're currently doing. But yes, it's exactly what we've done with the silica control tool. We've standardized the data that we wish to collect around that. Now, that's very project specific, but you could imagine that a more general data collection tool will be simpler, not more complex.
I have to apologize to Ron and Janice, and we're just running out of time, and we'll catch him at the break and the stretch, and you just want to, go ahead, and the website.
And the website.
Yeah, and you, just a thank you to you, and thanks again. Yeah, thank you to Hugh.